Okay, whenever you're ready. Or wait, I have to say. How does the rotator cuff work?
The rotator cuff is a group of 4 muscles that surround the humeral head. So this is a right humerus and this is the right scapula. It's attaching here. The 4 muscles come in the front, in the top, and then 2 of them are behind. And the key to those muscles is they help pull the humeral head in to stabilize it, and then they guide the humeral head in that socket. So as your arm goes up over your head, the rotator cuff has to guide this head of the humerus down so that you don't have the bone impinging up here. If something's tight, something's weak, or something's not coordinating well, then what starts to happen is the tendons that are passing right through there get pinched or impinged, and that leads to shoulder pain and shoulder problems.
So what tissues do they use to replace this ligament?
For the Tommy John surgery, replacing this ligament, they actually use a tendon, and one of the easiest tendons to get to is a little one right here in the wrist. It's called the palmaris longus tendon, and it's a nice long tendon with a very small muscle. So they'll take that tendon and then weave it through to replace that ligament and tighten everything up. Tendons and ligaments are made out of the same exact tissues, so as that tendon remodels, it's going to have the same function. The other way that they might replace this ligament is take a graft from your patellar tendon down here, which is the same thing they often do when they do an ACL, ligament repair of the knee. And then the third option is taking a tendon from a cadaver and transferring it in there. That tends to usually be the last option, but the surgeon decides on which is the best option for the person.
Okay, so how does Tommy John surgery work?
The Tommy John surgery is for helping replace the ligament here at the elbow on the medial side. What happens is, especially pitchers, throwers, but the pitchers the most, it's an overuse injury where this ligament is experiencing so much forces with every single throw. The repetitive throwing and then the rotation put such extreme forces through this ligament that it starts to break down and tear and overstretch. So for professional pitchers, they found they can go in and basically replace that ligament. They sew in it here to replace and tighten it back up again, and then the rehab takes up to 1 to 2 years, and it's only going to be done on professional athletes, somebody that's very serious about this.
Okay. So what are the cause of shin splints?
The cause of shin splints is usually the muscle along the leg that's pulling away, and actually this muscle attaches to the back of the leg, but usually people feel some kind of pain up here. So yeah, it's like a tendinitis of that muscle as it pulls away from the bone.
So why are shin splints so common in runners and dancers?
Because both of them are demanding a lot from their feet, and shin splints is usually an overuse injury. So if they're have all of a sudden upped their training or are just doing repetitive jumping or dancing or running, then they're going to put more demands on the muscles that are trying to help support the foot.
Go.
Why do you think shin splints happen in 2 different places?
The muscle that's mostly the cause of shin splints is called the posterior tibialis, and this picture is showing you the back of the leg with the bones of the tibia and the fibula, and then this is the bottom of the foot. This big red area right here is showing you where the attachment of the posterior tibialis muscle is, and it's attaching to both the tibia, the fibula, and along what's called the interosseous membrane. So that is the muscle that's getting overused. So what happens is, depending on where it's probably tugging at the bone the most, is where you happen to feel the pain, but it's not usually deep in that posterior compartment of the leg. you tend to, again, feel it up front. So it depends which part is sort of getting pulled away, or the tendonitis type issue with that muscle that causes the pain, and that's probably why it varies on which side of the leg, which is either side of the front of the shin.
Go.
So what is the function of the Achilles tendon?
So the Achilles tendon attaches the two different muscles, the gastrocnemius and the soleus, to the heel, and those muscles are in charge of doing plantar flexion. So if you point that way, that's going to be plantar flexion. But if we make her stand up and turn around and look down here, here's your Achilles tendons. And so rise up onto your tippy toes. That is what the muscle's doing. It's attaching this muscle to here, and it causes that plantar flexion, or rising up onto the toes.
Right, okay. Why is Achilles tendonitis such a common injury in dancers such as myself?
Dancers really are working on lots of jumping and rising up onto their toes. So they're, again, demanding a lot of their calf muscle and then into the Achilles tendon to hold them up. So again, it's an overuse injury. If they weren't putting that kind of demand on the tendon day in and day out, and not giving it the kind of rest it needs, it would probably be fine.
Go.
So what are some treatment options besides rest?
It's a tendonitis, which means inflammation of the tendon. So again, you always can go with your RICE, rest, ice, compression, elevation. And so ice is going to help always decrease the inflammation. Compression would be if something was really swollen, but that doesn't work so well with Achilles tendon. Elevation, okay, yeah, when it's real acute. But so you're really looking at ice. You could be taking some anti-inflammatories to bring the swelling down. But the main thing is to rebuild the strength, but not overuse it. So that's the balance of rest, then start re-strengthening. And also with that, you always want to be stretching the tendon, because it needs to have good pliability. When something first starts to heal, it tries to contract and shorten. So you need to be stretching it out every day, which most people are familiar with, like a runner stretch, a calf stretch that you're doing.
What things can you do to prevent tearing your ACL?
A lot of studies they're finding now is a lot about the biomechanics of how you land every time with your foot down. A lot of ACL injuries are just truly impact injuries, like a skiing injury or even soccer. You're hit and tackled, and there's not a lot you can do about that. But for the people that weren't really doing a whole lot and just plant their foot one time and turn and tear it, those are the people that we're finding control of their femurs and their hip, and really teaching them as they land and they line up. They've done this especially with female athletes and studies on them. Every time that they go into a landing after a squat or something, it's really watching where the knee is lined up to the feet. So a lot of times, especially we'll see in female athletes, as they jump and as they land, what they'll do is be landing so that the knees are inside relative to the foot. So what they're showing is you can train these athletes, and they've done this with college, I know, women's soccer players. There's some studies showing it. Bloopers after.
Oh, yeah.
We already have quite a few bloopers.
That is true.
It's very, yeah. Okay, go?
Yep.
Okay. Do you think athletes are being pushed too far at a young age to the point of tearing their ACL?
I'm not sure. I'm sure there's a lot of studies out there trying to answer that question. We do see it now in the teenage athletes, but I think, again, it's, my sense is because there's just so many more kids now competing at a higher level, and it's just one of those things that's going to happen because there's so much more forces and demands being put on the body. So those forces and demands statistically would lead to maybe that many injuries anyways. Is it because these kids are younger and they don't have the strength? That's what some of the studies are trying to see if that's out there, and I haven't really heard if they've concluded that yet or not.
Oh, yeah.
Okay. What is the rehab process following an ACL tear?
If it's a complete tear and it's a young, again, athlete that wants to be participating in cutting sports again, it usually will require surgery. And then following the surgery, you go through an extensive, lots of different exercises with a physical therapist to get your motion back, to get the swelling down, to get your strength back, and to get to the point where, again, you're running and functioning again. So early on exercises are things like what we call quad sets, which is just tightening up this muscle here, straight leg raises, holding it tight, and then you progress into more and more things where you're putting your foot on the ground and going into little squats or deeper squats, lunges, to the point eventually where then you can return to running and jumping.
Huzzah. We're starting?
Yep.
Okay. What is the best thing to do immediately after you've injured a muscle?
Again, RICE, so rest, ice, compression, elevation. The main one of those that's going to benefit the most is going to be the ice, and actually combining ice with compression is the best way to get that muscle really cold. So take wherever the muscle is, if it's your quad muscle, get the ice on it where the injured area is, and take an ACE wrap and wrap it around, and that'll compress, and that'll get the ice with the compression as the best thing. Anti-inflammatories can help too, and then rest means, you know, don't do activities that are going to really make you contract that muscle. So if you pulled your quad muscle, you're not going to go start jumping and running again. Once you can walk without pain, then you can slowly start building into more and more exercises.
Go.
Why is it so important to stretch?
When we're stretching, we're actually helping loosen up the muscles that are going to be contracting and working. And muscles will function better when they're more pliable and loose. That's why you always see like them massaging the athletes and loosening them up. But also think of the muscle, I like to think of it like a rubber band. And if you've got a really tight rubber band, you're not going to absorb the forces so well. You don't have as much give to it. So when you have more flexibility for any joint, any body part, you're going to absorb the forces. So as you take impact to it, you're going to be able to absorb those forces better. So that if you stretch, you keep yourself more limber, you absorb forces better, and you're less apt to have injuries.
So remember, don't forget to stretch.